Good afternoon, everyone. This is Bill Even, your CEO at the National Pork Checkoff here in Des Moines, Iowa. Welcome to this afternoon's webinar covering COVID-19 financial resources, a current public health situation update, and some biosecurity tips from the folks here at the Pork Board. On the next slide, you will see our antitrust statement. The antitrust statement is something that we take very seriously here. We understand there's a lot of conversations in the countryside and everybody's trying to help, but at the end of the day, we want to make sure that we don't violate any laws in the work that we're doing. As an additional reminder, the views expressed by our invited guests are theirs and not those of the National Pork Board, which does not advocate or endorse any particular production, marketing, or business direction. On the next slide, we've got the list of our speakers. Myself, yours truly, Bill Even. We're pleased to have with us today Kent Bang, the Vice President of Compeer Financial, Dr. Heather Fowler, who is with the National Pork Board as the Director of Producer and Public Health, and Montserrat Torremorell, Associate Professor from the University of Minnesota. On the next slide, we have our agenda. We're going to touch base on the CARES Act details. We're getting a lot of questions around the Paycheck Protection Program for agriculture. We're going to have an update on the COVID-19 public health situation, along with practical biosecurity recommendations for you on your farm. And then I've got one slide at the end, just a quick snapshot and some bullets around what's happening in the supply chain. And with that, on the next slide, I'm going to turn the floor over to Kent Bang with Compeer Financial. Take it away, Kent.
Yeah, thank you, Bill, and good afternoon, everyone. I wanted to spend some time here, and I appreciate the opportunity to spend a little time with producers here today talking about this coronavirus crisis and more specifically what the Coronavirus Aid, Relief, and Economic Security Act does. This is the CARES Act, as defined by the SBA, and we'll get into that in a little bit. I also just wanted to bring up the fact that we do have the government working on some USDA programs. I'm not going to get into the detail of that today simply because that is still being developed. But I would say this, I have been trying to keep up with that as best I can this week, and trying to understand what the plan is. The last I saw today, there's a lot of discussion going around, and there was some comments about maybe even this week some direct aid towards livestock producers, so that's good news. If you could go to the next slide, the CARES Act was passed into law on March 27th. And to tell you how fast this was moving, by April 3rd, we were taking applications. This is a SBA forgivable loan program. It's designed to help small business, and this go round for SBA, agriculture is included. So this is the payroll or the Paycheck Protection Program, or PPP, that is designed to essentially assist small businesses in continuing to meet payroll. So if you go to the next slide, the Paycheck Program generally is available to companies that have 500 or fewer employees. It expands eligibility under the SBA 7A program to help businesses cover costs related to payroll. And that includes healthcare costs, obviously payroll, rent, mortgage, interest, and interest on existing debt and utility payments. So a broad range that the funds can be used for, but it's specifically, and we'll get into some of the details quickly, but it's specifically directed towards the payroll and keeping people employed. As I said, the application started April 3rd. Businesses with payroll, any business with payroll was able to connect and apply. On April 10th, just this last Monday, or last Friday, independent contractors and self-employed individuals could apply for funds as well through SBA. The program is open till June 30th, but we've seen a significant rush towards getting applications in and getting approval quickly, just simply because of some fear in funding limitations. This requires no collateral for the loan, no personal guarantee for the loan. So important to remember. Generally, the loan amount is based on 2.5 times your average monthly payroll costs. And it's limited to $10 million loans, but again, 2.5 times what the average monthly payroll costs were. And the period of time that's used is April 1st of 2019 through March 30th or 31st of 2020. So 12 months average payroll on a monthly basis times 2.5 is the amount that is applied for. You may be eligible to have all or a portion of that loan, the principal forgiven on SBA rules, and I'll get into that as well. The terms of the loan are 2 years, interest rate is 1%, and there are no fees. No fees from SBA, and there should be no fees from your lender as well to pull it together. So on the next slide, the Paycheck Protection Program, just wanted to give a little bit of detail on what counts as payroll costs. Again, that's salary, wages, commissions. It also includes benefit costs for a wide range of benefits that are part of your payroll expense. State and local taxes as well. And then for sole proprietor or independent contractor, again, it's wages, commissions, income, or net earnings from self-employment. All of these, irregardless of whether it's self-employed or is part of the payroll from a business, the cap for an individual is $100,000 per employee. So that's per individual. So anything a single individual would get in a combination of salary, benefits, whatever that might be, would be capped at $100,000 a year. So to the next slide, the loan forgiveness is an important piece of this for everyone I know. We would expect, our expectations would be that most of these loans would be forgiven. So the eligibility to have them forgiven is based on maintaining the payroll and spending the money on qualified costs. So the loan forgiveness is reduced if payroll costs are less than 75% during the year that they were examined and applied for, and that at least 75% of that loan, those loan funds, were used in payroll over the next 8-week period. So as long as you're maintaining the same number of employees and at least 75% of that base loan goes back to payroll, then you'd qualify for the forgiveness of that loan. You must maintain staff numbers, as I said, and that is again in 8 weeks. The critical period will be 8 weeks from the time the loan is made, and following that to maintain the payroll and the expenses on that loan to have it forgiven. So the next slide, since agriculture is new to this SBA 7A program, the lender eligibility was expanded. So clearly all SBA certified lenders from the past are eligible to make these loans. The inclusion was the Farm Credit System in this. They were allowed to come in under this program, and many did. Compeer, for example, is a Farm Credit Association and was allowed. We just made the decision that we were going to do it and support our clients and make it easy for them to apply. So we're part of it as well. Other lenders in the Farm Credit System, other lenders outside of SBA lenders that made the decision could become an eligible lender through the SBA for this program. Again, 100%, the loans are 100% guaranteed by SBA. All fees are waived by the SBA. Underwriting required. We need to verify, or we have to verify that the borrower was in operation. So generally that means to collect entity docs to show that you were in operation, but in on February 15th of 2020 and before, so not hard to do. And then verify that the employee, that the borrower had employees, and that the dollar average amount makes sense. And I say makes sense, and that sounds a little vague, but we are generally taking tax documents for 2019 and then going back and comparing them to the year of submission, which would be not a calendar year. So that is April through March of 2020, that 12-month period. And if they make sense, they're not going to match exactly, but if they make sense, that's what we use to verify it. And again, that those that are paid over 100,000 with benefits and taxes and so forth are limited to the 100,000 in that payroll calculation. So the next slide. So these PPP loans, they are due or mature in 2 years, but will again likely be forgiven well before that. It's during the first 8 weeks that the money is spent on payroll and other eligible expenses, and we as a lender are required to make a decision on the forgiveness of the loan within 60 days of your submission. So clearly you'd want to get that done as quickly as you can. Again, interest rate is 1%. All payments are deferred for 6 months, but interest will accrue. So there's no payments during the first 6 months of the program. No prepayment penalties or fees, no collateral required, and no personal guarantee. So I think as you look at opportunities to help in the time of a crisis, this is one that I think many can use, if not all. And I would encourage you to, number one, talk to your lender. Number two, go to sba.gov and find out if your lender is a qualified or an eligible lender in this. And I would say number three, email me or National Pork Board and have them send it to me, and I'll help you find a lender that can help you work through it. So that's what I had for today. At this point, I'd like to turn it over to Dr. Heather Fowler, the Director of Producer and Public Health at National Pork Board. Thank you very much.
Thank you so much, Kent. I will be, hi everyone, Dr. Heather Fowler here. I will be giving you guys a brief public health update since the last time we met just a month ago. Next slide, please. First, quick update is really on the case count and the numbers. If you recall, just a month ago, we had around 4,000 cases in the United States. We're close to about 600,000 now. Worldwide, we had about 180,000. We're closer to 2 million now. The Johns Hopkins University still remains a great resource if you're interested in seeing a world map and cases. They've also added, as you can see in the blue here, number total tested, in the United States. So you can see just under 3 million tested to date in the United States. Of those, around 600,000 are positive, so just around 20%. Next slide, please. As it relates to the cases in the United States and public health information, the Centers for Disease Control and Prevention, or the CDC, remains the major source of that information. And they've been extremely busy working on all sorts of different guidance documents for different situations. Just yesterday when I checked, they had 89 different documents with the promise of new documents coming out in the near future, as well as the existing documents being updated with the most up-to-date science. As it relates to the case counts and distribution, if you think back again a month ago, we were looking at Washington State, but also New York State. And now lately, a lot of the focus has been on New York State and specifically New York City, which is considered to be the epicenter of the outbreak currently. Next slide, please. Of the public health recommendations that have changed, the most recent one that I wanted to cover was the cloth-based coverings recommendation. And that was based on new science that suggests that there can be and there are asymptomatic carriers of COVID-19 that can be spreading, that can be involved in the spreading or transmission of the disease to other non-infected individuals. I just want to clarify this recommendation. The cloth face covering is meant to protect the public, not the wearer. It is different from what we consider when we think of personal protective equipment or PPE, such as the N95 respirators that folks may wear in the barn, especially during flu season. Because PPE, as the name suggests, is meant to protect you. You wear goggles to protect your eyes, you wear a mask to protect your lungs. In this case, the cloth face covering is based on that understanding, again, of asymptomatic carriers and wanting to prevent the unknown spread of disease when individuals are in public and not showing signs of disease. With that said, there was kind of a mixed feelings around it, and I think it was based, again, on that misunderstanding of that it's there to protect the wearer and not to protect the wearer, but instead the public. With that said, social distancing, which a lot of folks now are calling physical distancing, because reminder, with this, we've seen a lot of change in our day-to-day life, and we need each other more than ever. So we don't want to socially distance ourselves per se. We want to physically distance ourselves at that 6-foot mark at least. And we also want to make sure that we're washing our hands after touching contaminated surfaces. And it's this physical distancing and hand hygiene that are most effective. But still, we recommend cloth face coverings when out in public, when executing those tasks, including that physical distancing, is difficult. Next slide, please. As it relates to disinfectants and COVID-19, one of the first questions I got was, hey, Heather, do our veterinary disinfectants work against coronavirus? And generally, we have coronaviruses in swine, remember alphas and deltas. This COVID-19 is a beta coronavirus. So I suspect that a lot of our disinfectants likely do work. However, the EPA is in charge of really creating the list of disinfectants that are approved for COVID-19 and inactivating or killing COVID-19. With that said, they've been working to actively update their site and the list of disinfectants. And you'll notice if you go and check today, you'll see some common veterinary disinfectants listed there. And so we recommend that our producers, when searching the database, because there are some disinfectants that are present in the human health world as well as the veterinary world and may fall under a master label that may has that human health name, don't necessarily depend on just searching by the name. Look by the registration number. It's often abbreviated as shown here on the slide, directly on the label of the disinfectant that you're using. But you'll be happy to know that there are some common veterinary disinfectants now on that list, and likely others coming in the future. Next slide, please. As it relates to COVID-19 in animals, we know that COVID-19 originated in animals, more specifically a horseshoe bat. So we know it started in bats. We think there was an intermediate mammalian host, likely a scaly anteater or the pangolin. From there, it spilled into people and has spread very easily person to person. Though there's still a lot of concern around COVID-19 and what other species might be susceptible as a result. Globally, we've only seen 4 reports of COVID-19 in animals, 2 dogs in Hong Kong, 1 cat, 1 household cat in Belgium. And then most recently, and the reason for the image on the right here, is a tiger at the Bronx Zoo in New York. And keep in mind, New York City is considered the epicenter currently. We know that there's tons of community spread. And in the case of the positive tiger, and really in the case of all of the reports we've seen in animals to date, they've all involved sick caretakers. It's also important to acknowledge that the CDC has not updated or changed their recommendations as it relates to COVID-19 and contact with pets and animals as a result. They're essentially treating pets and animals as if they are other humans, if you will, in that situation where you have either known positive or exposed individuals. So limit contact if you are exposed and or if you test positive. Some good news, however, as it relates to other species, is that 2 studies so far suggest that pigs are not susceptible to infection with SARS-CoV-2, which is the virus that causes COVID-19. And this is something that we will continue to monitor very closely as more evidence hopefully supports the current research that suggests that they are not susceptible. My goodness, that's a tongue twister. Also, it's important to point out that there's still no evidence that food or food packaging play a role in transmission, and that is from the USDA as well as the FDA. Next slide, please. The most recent recommendation as it relates to workers, more specifically those that are considered critical infrastructure or essential workers, came out just last week, and it is specific to those individuals that were exposed to a person that was suspected or confirmed to have COVID-19. Now, this guidance, the key takeaway is that these individuals can continue working as long as they remain asymptomatic and precautions are followed. And so that is all covered in that one-page document there. We do link to it on our website. There are some sites that we're hearing, or excuse me, I should mention that CDC is potentially going to release other guidance on this topic as it relates to broadly screening. So again, this one is for individuals exposed to suspected or confirmed COVID-19 patients, but there might be additional guidance coming for broad screening. For those of you that are already conducting some kind of screening as folks arrive at your facility, keep in mind that we are going into allergy season, and make sure that we're not mixing up the respiratory signs from allergies, which generally include runny nose, sneezing, runny eyes, with COVID-19, which we think of fever, shortness of breath, and coughing. Also, if you're writing down or documenting in some way, shape, or form any of the respiratory screening questions that you might be asking employees at arrival, be sure to keep that information confidential. It is protected by HIPAA. Next slide, please. Finally, just want to remind you guys that we have resources available at the top of the list there. National Pork Board, our pork.org/COVID-19 landing page. It should be your main go-to resource. All the other links provided on this page are listed on that page. We make sure that we have the most up-to-date information on that page and are linking to these new guidance as they become available. So that is essentially the long and short of it as it relates to public health updates. Next slide, I will then introduce Dr. Montserrat Torremorell at the University of Minnesota that will talk to you about safety on the farm.
Thank you very much, Heather. And what I would like to do today, thank you for the invitation, and I would like to do today is talk about some practical biosecurity recommendations to prevent COVID in farm workers and allied industry. Next slide. I want to start by saying that COVID-19 is a biosecurity threat like what we have not seen before. Here, our goal is to protect the producer, their family, and with that, everybody else who is part of the production chain. So by protecting the producers, the people who work at the farms, we will be able to protect the pigs then, and we will be able to care for the pigs and protect them from other diseases. So that's why it's important. I do want to emphasize that COVID-19 is a person-to-person transmitted disease, and this is very important to understand. If we understand that, then we will understand the biosecurity practices that we are trying to put in place. This is a virus that is transmitted mostly by direct contact with infected persons, but also the virus can be shed in aerosols, so transmitted through aerosols and droplets, but also infected people, we tend to touch our faces when we are sick, and then it's easy that we contaminate our hands, and then we contaminate surfaces when we touch those surfaces with the contaminated hands. So that's important to understand that. So we care about close contact with other persons. We also care about potential contaminated aerosols or droplets, and then contaminated surfaces. Next slide, please. So if we think in terms of what to do at the farm level, the first thing I want you to think about is the farm access. Who needs to come to the farm, and what are we asking the people that come to the farm? The first thing is that if somebody is sick, the best way to prevent the introduction of the disease to other people it's to stay at home, even if the symptoms are mild. If you're sick, stay at home. The second thing is to limit the access to the farm just to those personnel that have to be at the farm. So what we call essential personnel, or personnel that have to do essential activities. Let's say repairs or taking care of the animals that really needs to happen. So limit the visitors as much as you can and focus on the essential personnel. The other thing that we talk about, again, because we want to avoid having a lot of people right next to each other, try to stagger the arrival of the workers at the farm so that not everybody gets in at the same time. We want to avoid that congregation in the common area spaces, whether it's the entry halls as they get ready to go into taking a shower, or even in the break rooms. So stagger the arrival of the workers. In some places, they are also considering staffing the farms to accommodate different schedules. For example, they will work Monday and Tuesday, and then Saturday and Sunday, one shift, and another shift will do Wednesday, Thursday, and Friday, for instance, or also divide the labor into morning and afternoon. Again, the goal there is that not everybody works together at the same time. In case there is some infection detected, at least we decrease the risk of transmission to others. And lastly, avoid the physical contact, such as shaking hands, in particular when greeting others. Next slide, please. The next thing is that the introduction of materials, and most of the swine farms will already have protocols that require that all the materials that they get introduced, they get clean and disinfected. So follow the farm protocols for that, but put a special emphasis on those personal objects like cell phones or lunch boxes that the person might have touched just as was coming in. So try to disinfect those before entering inside the farm. So put a special emphasis to the personal objects. Next slide, please. Then again, I want to emphasize the risk of infection to hands in particular. So it's important to keep areas clean and disinfect the common spaces like showers and break rooms after groups of people have gone through, and certainly by the end of the day, to maximize that hygiene protocols, but also clean and disinfect very frequently those surfaces that we tend to touch on a regular basis, like the working stations, the doors, the fridge, that sort of surfaces that are high transit areas. We want to make sure those get disinfected on a regular basis, clean and disinfected regularly. Then there is materials that we don't want to be sharing. Again, some of the kitchen utensils, use the dishwasher to clean those, but don't share them. And things like towels and so on, try not to use them by more than one person, and certainly wash them and dry them between uses. One of the things as well when trying to handle the clothes, to put back on the washing machine, wear gloves, do not shake the clothes. So again, that we minimize those particles that are in the clothes, minimize the dispersion of those particles, and then disinfect the areas where we handle the clothes. Next slide. In terms of personal care, there are three things that are very important to do. The first one is to wash hands frequently with soap. The CDC recommends that hand washing should take about 20 seconds to do a good job. And it also is recommended to use hand sanitizer if the soap is not available. So washing hands is one of the most important parts to do, and to do frequently throughout the day. The second thing is cover the cough. If for any reason somebody's coughing, cover the cough, use the sleeve. That's very important. And one that we tend to forget is the touching of the face, the eyes, or the mouth. In particular, if we haven't washed hands, again, even if we get exposed in an environment where the virus may be present, the virus still has to get into the person, to infect the person. And the most likely way how that happens is by us, with our face, touching the face, the mouth, and getting the virus that way into our body. So next slide. The other thing we want to keep in mind about is this concept of social, or what Heather was saying before, physical distancing. The CDC makes the recommendation to keep distances person to person of about 6 feet distance between the people. So if we apply that at the farm level, what that means is avoid having groups of people in the same area space, or that the groups are very small and that the people can be distributed. Like, for example, in the break room, we recommend to have 2 or 3 people at once, depending on the design and so on of the rooms. So keep that in mind as you plan the break times, or even when the people get to some of the common areas inside the farm, try to keep those distances. Try to limit the face-to-face meetings as much as possible, if you can, with your providers or with the supervisors that oversee different farms. Try to use conference call, text, or email instead of having to go inside the farm to do some of those activities. Again, physical distancing is one of the most important recommendations that we want to emphasize. Next slide, please. Okay, so this concept of physical distancing, we also want to extend it outside of work, because that's most likely the place where we may get exposed to the virus. So we want to limit interaction with other people outside of work. Try to avoid travel to areas where there might be viral recirculation, so avoid that travel. Try to limit as well the carpooling, or limit those opportunities in which you have to be right next to another person, or at least try to limit that to situations. And try to limit as well your trips to places unless you have to go, like besides the grocery or the pharmacies. Try to avoid large crowds. We've seen that being one of emphasis, and some of the recommendations change over continuously, so you may want to stay posted on the recommendations by the CDC. Next slide, please. So the other part that is important is to communicate. If you or somebody at the farm tests positive, or even a family member tests positive, or is suspected to have been exposed, let the supervisor know and try to seek advice on how to proceed. So clinical infections are known to play a role in spreading the virus, and here what we are trying to do is anticipate those situations when that exposure might have taken place, so we prevent infection to others. Okay, so look for the recommendations from the CDC and also your state health department, because the recommendations might change. But again, being proactive and having those communications with your people at the farm even before any of this happens is important, so they know what to do. Next slide, please. Again, emphasizing communication and anticipating what may be coming down the road, planning for the worst but hoping for the best in some way. Keep in mind plans, contingency plans. Try to have those discussions ahead about who will take care of the animals if the workers get sick, or who will be able to come to work if the schools, as we've seen in Minnesota already, are closed, or if one of the family members gets sick. So that's important to consider in preparation for what to do in the case of if the disease is reported. Certainly consider having sick leave policies and be building that trust so people are comfortable reporting if there is any illnesses. So having that knowledge is helpful to plan for what to do at the farm level. Next slide, please. With this, I talked about biosecurity, but I also want to emphasize that this is a time of a lot of stress for farmers and for everybody involved on the care of the animals. So it's a difficult time, and I know that personally, being the daughter of a farmer that suffered from depression, so it's important to remember your neighbors and friends. And I wanted to put this slide in particular to point out that there are resources, and here I'm just highlighting the resources that are posted at the website from the UMash Center at the University of Minnesota, where there is information for farmers in particular about mental health and what to do in these difficult situations. With that, next slide, please. I just want to summarize again. If I want 4 points that I would like for you to remember after this call. Point number one, stay home if you are ill, even if you just think it's a minor cold. That's point number one, to protect the others at the farm level. Wash your hands. Again, that's one of the simple things we can do and most effective things to stay healthy at the individual level, together with avoid touching your face or your mouth or your eyes. So that's very important to protect yourself. And then to protect yourself and protect others, again, it's practice the physical distancing so that we decrease the risk of exposure. I have listed some of the resources here as well, which are similar to the ones that Heather listed. I think with that, my next slide, just want to thank you for your attention. And I believe if you have questions, you can text them or put them in via chat, and they will be addressed in the next few days. And with that, I would like to turn it over to Bill Even. Thank you.
Thanks, Monse. And again, this is Bill Even. I got one slide just to close here this afternoon, if you want to go to the next slide. Really on the supply chain, this is what we're seeing. If you want to put some numbers on it, the U.S., Americans eat about 7.5 billion pounds of meat per month, around 22, almost 23 pounds per person of pork, beef, and poultry when you roll it all up. And when you do the math out on what we're currently sitting in cold storage, we've got about 1/3 of U.S. monthly meat demand sitting in cold storage inventory now, able and ready to go into the retail supply chain. But the fundamental problem we're seeing with plant slowdowns and some temporary closures that we've seen in Iowa and South Dakota is on the pork side is that these plants are going to cause supply chain disruption. Our logistics to chain has been screwed up now for a month, and these things are just going to continue to add to it. I think the major takeaway for us in the pork industry and as consumers is really this. We have got to figure out and ensure a way to balance public health and food production. Food production in the United States as a directive from a national security standpoint from the White House that we must operate. So farms all the way up through to the grocery stores have to operate while we're dealing with the public health side of this pandemic. You know, the information you got from Heather and Monse here today is an example of being smart about what we need to do to manage the public health side of this while we continue to produce food. And if another proof point, if you're trying to quantify this, you look at the Columbus Junction, Iowa Tyson plant that was down, and the John Morrell Smithfield plant in Sioux Falls, South Dakota that's down. Together, they're about 5.8% of US pork production capacity. And what that boils down to is probably over 3.5 million pounds less pork is going into the system each day. Now, we've got the slack in the chain to handle this, and consumers need to know that there's no shortage of meat in the country, and that food and meat is perfectly safe to consume and eat and handle. But these ongoing issues with plant slowdowns are really going to start to compound the ripple effect here in the US. And we're working very closely with all of our producers and our producer board, talking with the packing industry as well as many other folks to make sure that we are offering solutions the best we can to these problems. Kent Bang, who from Compeer, that was the intent of having him on the call. We've got to have credit availability while these producers are trying to hold their breath underwater for the next 90 days or however long this is going to take. I think that's really important that webinars like this with experts like you heard from today, that's part of our job here at the Pork Checkoff, is to get those resources out to you. So whether you're a producer or a veterinarian or somebody working in the industry, you know who to turn to try to get answers to questions so that you can keep working safely. And on the next slide, I want to remind you that we do have the pork.org/COVID-19 webpage. That is updated daily, hourly with the most current information around major questions we're getting from producers. Please go to it and use those resources and share them with others. With that, thanks for all you're doing out there. This is going to be a rough couple of weeks in front of us, but I want to let you know that the Pork Checkoff is here working for you on your behalf. Don't be shy about reaching out to talk to us. The other point is anybody that asks questions, we will be providing the answers to those questions to everybody on the webinar, and we will also be sending you these slides as well as a recording. So you've got those to share and use in your businesses. Thanks very much, and have a good rest of your Tuesday. Goodbye.
Heather? Claire?